Good evening. I'm Jim Axelrod, and this is a Western edition of the broadcast. For the first time ever, someone infected with the deadly Ebola virus has been brought into the country for treatment. Dr. Kent Brantly, who was working with Ebola patients in West Africa when he contracted the disease himself, arrived late this morning just outside Atlanta in a Gulfstream jet specially outfitted with an isolation tent. From there, he was transported in an ambulance to the Emory University Hospital, where surprisingly he was strong enough to walk into the hospital. Emory has one of the most sophisticated infectious disease units in the country. Brantly was working with the Christian missionary group Samaritan's Purse, caring for Ebola patients in Liberia when he got sick. Vicente Arenas picks up the story in Atlanta.
A private medical jet carrying Dr. Kent Brantly landed at Dobbins Air Reserve Base in Marietta, Georgia, around 11:20 this morning. Inside the plane, Dr. Brantly was kept in an isolation tent and wore a suit to prevent him from infecting medical workers with him. The 33-year-old physician from Texas was then transported by an ambulance outfitted with internal protective drapes to Emory University Hospital 20 miles away. He walked into the facility with help from a paramedic. He'll be kept in an isolation unit that was built in collaboration with the nearby CDC. Dr. Jay Varkey is an infectious disease specialist at Emory University Hospital.
Do you worry when you go in and treat a patient that has a disease like Ebola?
I don't. I truly believe in the practices we have in place, and I have no specific concerns either for my personal safety or for my colleagues.
The doctors will wear protective suits. The Ebola virus can only be transmitted through close contact and bodily fluids. The CDC points out the chance of Ebola spreading to the workers and others in the U.S. is highly unlikely. Doctors say Brantly's chances of survival at Emory are much higher than they would be in West Africa.
We can deliver a substantially higher level of care and a substantially higher level of support to optimize the likelihood that those patients will survive this episode.
The CDC says the only way to end the epidemic for now is to stop it at its source.
Policy Unit 2.
The agency's Emergency Operations Center is tracking Ebola's spread in Africa and helping organizations figure out how to keep other people from becoming infected.
Dr. Brantly was last listed in serious condition. His wife issued a statement today. She spoke to him by phone, and she says that he's glad to be back in the U.S. Meantime, the other worker fighting Ebola is scheduled to be back here in the United States in the next couple of days. Jim?
Vicente, thank you.